All right, welcome everyone to the 2020 commemoration of the World Elder Abuse Awareness Day. This year, more than ever before, it truly is a World Day. Good morning, Americas. Good afternoon, Europe, Africa, and the Middle East. And to our colleagues and friends in Asia and Australia, thanks for staying up late. My name is Amal Abu Rafa, and I lead the program on aging in New York. And I'm very happy to co-moderate this webinar with my colleague, Monica Ferro, who is the director of the UNFPA Geneva office. This day is unique because it did not start at the UN, but rather was launched by the International Network for the Prevention of Elder Abuse back in 2006. It actually took the UN another 5 years to designate it as a UN day. But what's also unique are the two organizers of today's event. Susan Summers, president of the International Network for the Prevention of Elder Abuse, and Sylvia Perel-Levine, chair of the NGO Committee on Aging in Geneva. One does not have to look too far to find inspiring champions determined to enhance the recognition of the dignity of older persons. When it comes to protecting the rights of older people, I've known Sylvia and Susan to find no comfort in wishful thinking and are hardly ever impressed by political promises. Over the years, they have shown courageous determination to rip off the cloak of invisibility around elder abuse as they continue to lead the advocacy work at the UN in New York and in Geneva along this great cause. We're grateful to you both for putting together today's event together. Thank you so much. Our theme this year could not but be around COVID-19. This pandemic is not, as what is often said, the great equalizer, where we are all in this together. It is the great revealer, and guess what? We're not all in this together. This pandemic exposed significant risks that older people face. Many of these risks are not new, as highlighted in the Secretary General's policy brief, a brief that was supported by 146 member states. This pandemic exposed a hysterically age-phobic world, and in terms of elder abuse, violence, and neglect, it showed that we're in a deep crisis of values. Distressing reports indicating instances of neglect and mistreatment of older people, particularly in care homes and institutions, is a mark of shame on all our societies. It is, at its very core, an issue of fundamental human rights. The Secretary General himself, for the first time ever, called upon the General Assembly open-ended working group on aging, a working group that would have celebrated its 10th anniversary this year, to develop proposals for an internationally legally binding instrument to protect the rights of older persons. As such, today's topic could not be more timely and relevant. I want to remind you that a recording of this webinar will be made available and posted online. And due to the large number of participants, we will be muting everyone during the webinar. However, please feel free to ask questions at any point during the panel discussion using the Q&A tab on your screen. And we are lucky to be in the very good hands of my colleague, Monica, who will accommodate as many questions as possible throughout the event and pose them to today's esteemed group of experts. I wish to welcome Claudia Mahler, the UN independent expert on the enjoyment of all human rights by older persons, Dr. Etienne Krug, Director of the Department of Social Determinants of Health at WHO, who also manages a wonderful team of colleagues that work on the decade. Big shout out to Alana and Mary from my end. Jeline Gunther, who's the National Director of Bank Safe at the AARP Public Policy Institute. Chief Kikulomo Edwards, the founder and CEO of the Dementia Care Society of Nigeria. And for the first time on such an event, an assistant professor of marketing, Professor Michael Mulvey from the University of Ottawa, welcome everyone. We have a really exciting lineup of panelists in today's event. So let's get it started, and I will give the floor to His Excellency, Ambassador Milenko Skoknik, who's the permanent representative of Chile and chairs the Group of Friends of Older Persons in New York. Your Excellency, thank you so much. Good morning. You have the floor, sir.
Good morning here in New York, and good afternoon to everyone in Geneva and other parts of the world. It's an honor for me to participate on this event on behalf of the Group of Friends of Older Persons here in UN New York. And let me say that the group is comprised of Argentina, Bolivia, Brazil, Colombia, Costa Rica, the Dominican Republic, Ecuador, El Salvador, Guatemala, Honduras, Indonesia, Kenya, Malaysia, Mexico, Panama, Peru, Qatar, Slovenia, South Africa, Trinidad and Tobago, Turkey, Uruguay, and my own country, Chile. First of all, please allow me to thank the organizers for convening this event in commemoration of this 8th anniversary of the World Elder Abuse Awareness Day. And everyone that is going to be in the panelists, thank you so much for your participation, and special greetings to my colleagues who are part of the group of friends of older persons there in Geneva, and my colleague from Austria, Robert Miller. The theme of this year, as you mentioned, is the impact of COVID, and of course that highlights the importance of taking actions to combat and prevent elder abuse and restore the human rights and dignity for all those affected or at risk to successfully be able to respond to COVID. And elder abuse is a global and growing phenomenon, unfortunately. Although its true magnitude is still unknown due to the lack of data, awareness, and sometimes under-reporting. But anyway, we can estimate that around 140 million people worldwide is suffering from abuse from being in the older persons category. And this COVID pandemic is having a devastating impact across the world, with a disproportionate risk for fatality, poverty, discrimination, and isolation to older people. So I think the Secretary General policy brief on the impact of COVID is very welcome and timely because puts the focus on what we need to do. And there we need to, of course, reduce violence against older persons, and especially older women depending on family members for their daily survival. Today, with the pandemic, our national effort must be greater, looking for adequate answers targeted to the specific problems and need of older persons. And there it is fundamental to foster the capacity of states for more effectively with data collecting, statistic, and qualitative information disaggregated by sex, age, and other relevant factors as necessary. In order to conclude, because I know there is a long list of panelists and very important presentations, let me say that we believe that a successful response to COVID-19 with a human rights approach for older persons can be achieved through our shared efforts, considering their opinions and necessities. And the international community must work together to ensure the well-being of older persons. Finally, allow us to recognize the valuable efforts by civil society in improving the situation of older persons worldwide, and to reiterate, the Group of Friends of Older Persons here in New York will continue to work tirelessly to promote the rights of all older persons around the world. Thank you very, very much for allowing me to speak early this morning.
Thank you so much, Your Excellency, for joining us. We always appreciate it, and we count on Chile's championing older persons and the work at the UN. And thanks for highlighting the SG policy brief. And you're right, it doesn't mean much unless member states and other stakeholders commit to implementing the recommendations in it. I would like now to give the floor to His Excellency Robert Mueller, who's the Deputy Permanent Representative of Austria to the UN in Geneva, and who will be speaking on behalf of the Group of Friends of the Human Rights of Older Persons in Geneva. Mr. Mueller, you have the floor.
Hello, good morning, good afternoon, or good evening, depending on where you are right now. At the outset, I would like to thank the International Network for the Prevention of Elder Abuse and the NGO Committee on Aging for organizing the event, which we are glad to co-sponsor together with a group of friends on older persons. While I thank all the panelists here, I would like to take the opportunity to tell Mrs. Mahler, as this is our first opportunity to do so, that we would like to congratulate you on your appointment and wish you a lot of success for your term as mandate holder. We are looking forward to continue the close cooperation with your mandate. Now, the COVID-19 pandemic is one of the most dangerous challenges the world has faced in our lifetime. It is a crisis with severe health, social, and economic consequences, which disproportionately affects older persons. Although age-based discrimination and the lack of recognition of older persons in government policies pre-existed, the pandemic has dramatically exacerbated social stigma and ageism. Such age-based discrimination may affect the provision of services, as the treatment of older persons may be perceived as less important in a context of limited healthcare resources and the growing demand to ease restrictive measures in order to reactivate the economy. At the same time, measures to contain the spread of the virus, such as mandatory physical distancing, puts older persons in greater risk of isolation. This can affect their mental health and also make them more vulnerable to neglect and violence. The UN system has over the past month taken important initiatives in bringing attention to the rights of older persons. The UN Secretary General himself issued a comprehensive policy brief on this subject, while the High Commissioner for Human Rights, Michelle Bachelet, has issued specific guidance to states. As the Secretary General pointed out in his policy brief, COVID recovery provides an opportunity to set the stage for a more inclusive, equitable, and age-friendly society, firmly anchored in human rights. Today's event, which takes place in the context of World Elder Abuse Awareness Day, provides us with a timely opportunity to discuss more concretely how we can, at the national and international level, collectively move towards achieving this objective. In this regard, we are privileged to have with us an outstanding panel of experts on the rights of older persons. And we are looking forward to their insights. I wish all of us a very insightful debate. And thank you very much for your attention.
Thank you so much, Your Excellency. We count on your support, and we know how actively engaged the group of friends is with our colleagues at OHCHR in the headquarters in Geneva, and they count on your support again. And thank you for raising the issues of social stigma and ageism. I'm sure this will be something that will run through the discussions today in our meeting. I'll now turn to our esteemed panelists, and we'll get started with Ms. Claudia Mahler. Claudia, you, in your first month of your mandate, you basically hit the ground running. And I understand you're preparing your first report that's going to focus on the impact of COVID-19 and the rights of older persons. So if you could share some of your, your thoughts and work and what you've seen so far as it relates to elder abuse on that. You have the floor. Thank you.
Thank you, Amal, for your kind words, and thank you, everybody, for being here with us today. I would also like to thank the Excellency for the warm welcome and for the congratulations. First of all, let me also start with thanking the organizers for inviting me to this important webinar to raise awareness to elder abuse. As we already heard, COVID-19 crisis shed lights on older persons, but their voices, opinions, and concerns remain unheard. During the pandemic, we must witness that older persons' human rights are not enough protected, as already mentioned by the Excellencies, and older persons were really left behind. While we got the news that the number of older persons dying in homes, hospitals, and institutions was and is still growing exponentially all over the world, we also had to learn that ageist attitudes became worldwide more visible in the crisis. And this is disheartening to continue to read cruel and dehumanizing language on social media referring to older persons, while not mentioning to what extent older persons had contributed during the crisis, for example, as healthcare professionals, as grandmothers and grandfathers to support their families, in the supermarket, or for example, as community leaders. Expressions of online discrimination that disproportionately target older persons often create a climate of exclusion, intolerance, and hostility. These unregulated online expressions of elder abuse can increase the risk of human rights violations and abuse taking place offline against some of the most vulnerable segments of society. Negative comments severely impact the physical and mental health of older persons and promote negative images, and in the worst case, lead to violence, abuse, and neglect of older persons. Verbal abuse clearly occurs in the context when older persons face old age discrimination. I also want to raise your awareness that violence, abuse, and neglect are very often not visible to society because they occur behind closed doors. This might be one point why the number of violence, abuse, and neglect decreased during the lockdowns and isolation. When social distance is in place, it is even harder to find ways to get help and assistance or monitor the different settings. Societies must raise their voices against all sorts of violence, abuse, and neglect, and older persons, especially older women, must be included in discussion on prevention of all types of violence against them. And we also have to keep in mind that verbal abuse often occurs in tandem with mental, psychological, physical, sexual, or financial abuse. But we will hear more about this from other panelists. Derogatory comments in the media are a direct attack against the dignity of older persons. Policies based on ageist attitudes cannot be tolerated, and I urge states to monitor and implement measures to avoid ageist approaches. Older persons need to have access to justice, to accountability mechanisms that provide for remedies and redress when their human rights are violated. But I also want to state that older persons are rights holders, and their rights and dignity does not decrease with old age. The crisis also showed that we have to close the gaps in the human rights framework on the national and on the international level. And I want to say it once again, from my point of view, a convention would make a big difference, especially when we talk about elder abuse, which is one of the most unreported human rights violations. A legally binding instrument for older persons could address older persons targeted by verbal abuse. We have to work together and join our forces to make sure that everybody knows that verbal and online abuse is a violation of human rights of older persons, must not be tolerated, and must be stamped out. Thank you for your attention.
Thank you so much, Claudia. Your role and mandate is pivotal in reporting on developments and challenges and protection gaps in the realization of the rights of older persons. And we count on you in that, and you can count on our support from our end. Thank you so much. I now move to Dr. Etienne from WHO. I understand that WHO just released a guidance note on violence against older people in the context of COVID-19. Sir, if you could share with us more about that, you have the floor. Dr. Etienne, could you kindly unmute yourself? Thank you.
Sorry, I thought you would unmute. But thank you very much, Amal, and thank you to all for being here. Good morning, good evening, good afternoon. It's great to see so many people join us to talk about such an important topic, which is elder abuse, a topic that is too often hidden, taboo, or neglected still. And it's hard for me to understand because the numbers are huge. They were huge already before the pandemic, knowing that 1 in 6 people over 60 years of age experience some form of abuse every year, and that when talking to staff working in long-term care facilities, 2 in 3 report having witnessed or sometimes even committed abuse themselves. So we're talking about an issue that was huge already before the pandemic and has only gotten worse during this pandemic. So thanks very much to the organizers for setting up an event, because I think one of the first things to do is break the taboo and talk more about this topic. Elderly abuse happens in many different forms. We've already heard about it from Claudia and others, but it happens at home. During the lockdown in particular, we have now older people who are living sometimes alone, but sometimes dependent from other people. And in most cases, this happens very well, but in a substantial proportion of cases, older people are now even more dependent from the people who take care of them. And those people can be subject to stress, to increased economic stress, to alcohol abuse, to a number of risk factors which may lead to violence at home. It also unfortunately happens in long-term care facilities where the staff has been reduced due to the lockdown measures, to the illnesses of the staff themselves. And there too, older people are now living much more isolated from their families and their relatives, and have very little possibility to even talk about what is happening to them if they are victim of violence. And elder abuse is happening online. It was happening already before, but during this epidemic, we see increase in surge of scams directed at older people. I know it very well with my parents being older and very challenged by technological issues, and be really very easy prey for those who want to set up such scams. And as we've heard, ageism, which was already pervasive before the pandemic, is now getting worse during the pandemic, and this is a very important risk factor for elder abuse. So there's a lot that we can do, and I think the first thing is to talk about it, to put it in the open, and to make sure everybody's aware that this issue exists and needs to be tackled. Governments have a role in creating awareness, talking about it among the public, but also alerting community leaders, community workers about the importance to be looking aware of the symptoms, aware of the signs of elder abuse in order to be able to act. Governments also have to make sure to leave helplines open and accessible and share information about these helplines to those who need it. In healthcare and testing facilities, information has to be available. I went for a test not so long ago and was very pleased actually to see that there was only one poster on the wall, a white wall of the hospital, one poster with the helpline number for children, women, and older people who need to access support. Health providers and social services have to be on the lookout for signs in residential and nursing facilities. Although, of course, the situation is dire and hard for people working there, making sure that the contact still is established either through telephone or video or other mechanisms between older people and their families and friends is extremely important. And having very clear procedures about how to manage the burden, how to manage the stress in those facilities is extremely important in these difficult times. And of course, it is important also to talk to older people themselves, to involve them in finding the solutions, involve them in the responses so that they can also be part of the solution. So as you said, Amal, we have just issued new guidance on this topic. We've talked a lot with our colleagues here in WHO working on the COVID response about the importance of taking into account the needs of older people. And I encourage all of you to take a look. We have to spread the information about this guidance so that it is used in the countries that need it. And finally, we struggle with data on this issue. We struggled already before the outbreak, and we struggle still now to get good data. So I think all of us also have a duty to, or where we can, support monitoring and data collection and reporting on this important issue. Thanks very much.
Thank you, Etienne. We really appreciate the work that WHO does, not just in the short terms with all the guidance notes that your teams and others have produced, but also in the work that WHO is doing on building back better, integrating everything that we're learning into the work that's being done on the decade of healthy aging, on the global campaign to combat ageism, And I was just on a call at 6 a.m. this morning with one of your colleagues from WHO who's with us on the steering committee of the Titchfield City Group on Aging that's working on age disaggregated data. So thank you so much for joining us today. We really appreciate it. When we talk about elder abuse, we often forget that it also means financial exploitation. And we're very, very fortunate to have Jillian Gunther with us today, housing the global thought leadership on aging. Jillian, can you tell us some more about AARP's Bank Safe initiative? You have the floor.
Thank you so much, Amal. I very much appreciate the invitation to speak today about something that's really important to our organization, which is the prevention of financial exploitation, especially due to COVID-19. So if we look at, what is the problem, is that globally we're seeing 1 in 10 older adults, they're victims of financial exploitation, which the highest percentage is reported from Nigeria and Israel, and the lowest percentage is reported from Mexico. And why does this matter? When we look at the only studies on the cost of financial exploitation out there, we see this important point, which is that what the average victim loses is basically what the average person has in retirement. And we see this as evidence across the globe that in a blink of an eye, an older person can lose their entire life savings. So as we look at, how does exploitation happen? Regardless of whether your country is more towards the kind of cashless society and relying on financial institutions or cryptocurrency, one of the things that we see is that perpetrators go where the money is. And unfortunately, a lot of times that is that they're using the financial institutions as means to access the funds of older adults. So how has COVID-19 changed fraud, scams, and exploitation globally by industry? And what we're seeing is an attack on really 2 major industries that trickle down to older adults, an increase in 76% in telecommunications types fraud, and the top type there is credit cards. We're also seeing likewise an 11 to 12% increase in financial services and e-commerce, with the top types being identity theft and promotional abuse. Now, there is good news. There is a decrease in the types of scams that we're seeing, of course, with travel as well as gaming. But we're also seeing data, because of social distancing, is changing shopping patterns, of course. And fraudsters are taking notice, and they're targeting those digital industries. And we're seeing that older adults have lower levels of awareness, especially due to the social isolation. It really becomes a breeding ground for perpetrators as people are socially isolated, not only from scam artists, but also from family members, unfortunately, who may be unemployed or feeling the pressures of being able to pay their bills across that line and stealing from their parents or grandparents. In this study that was done, a global study from TransUnion, there was a quote from a participant who had to go to the financial institution to issue a new credit card. So how do we get ahead of this in light of COVID-19? And for AARP, this is real action before the money leaves the account. One of the things that we're doing, that we've had in place for a year now, is a 60-minute training specifically to the front lines of financial institutions, where they can learn not only how to recognize the red flags of exploitation, scams, and schemes, but also how to actually prevent them before the money leaves the account. And yesterday, for WEAD, we released a new module for COVID-19 that teaches those frontline staff at financial institutions who really have that second pair of eyes to protect older adults as they're getting online to do transactions which may be new to them, which puts them at risk, on how to recognize those red flags and how to stop them. And a lot of the scenarios in it go through things that the industry is seeing, which is an increase of exploitation that's going through the drive-through and call centers and online banking of financial institutions. With that, we think that this module will even increase the social impact and the effectiveness of this training. We did a scientific random study on the effectiveness of the training, where we know that this training actually saves money, that those who took the bank safe training saved 16 times more than those who did not take the training, and we expect that the COVID module will increase that social impact as well. What we've seen in terms of social impact from a year of launching this is that we've better protected 7 million consumers, and we hope to continue to do that as COVID-19 fraud and exploitation increases globally. Thank you.
Thank you so much, Jillian. This is actually really interesting, and especially when it comes to who the perpetrators are, we always think of the other or someone from outside, and we know that's not the case when it comes to elder abuse specifically. And again, thank you to ARP for the forward-thinking, innovative role it continues to play when it comes to aging and disrupting aging. I'd like to move now to Ms. Kiki Edwards, who will share with us from her very long experiences especially from the work that she's done through the center that she set up in Nigeria. Kiki, thank you so much for joining us today. You have the floor.
Thank you very much, Amal. Thank you. Now, the stigma concerning people with dementia, it's been a very hard thing to cope with. And then along comes COVID-19. Now, people are being called witches just because they're talking to themselves, and then they're being stoned to death or being burnt alive. That's already abuse on such a scale that it's very, to the rest of the world, seems very barbaric. But now, with the COVID-19 showing up, we have to find a way of assisting these people being accused to ensure that the abuse that's been inflicted upon them doesn't happen. Now, due to the awareness that we've been raising about dementia and what it is and what it is not, people are becoming more aware of how they treat people with dementia. Now, with the lockdown that is being imposed upon people in Nigeria, I mean, every country is very different. Every country's situation is very different. If you do not provide the means for the people to eat, that's already abuse. They can't go out to work, and you do not provide them sustenance. How do they cope? That's another thing to think about.
There might be a short delay. I'm sure Kiki will connect again.
I can see the blessing in the healthcare system, shortcoming in the social care, and the shortcoming especially of lack of legal instruments to protect vulnerable people with dementia. So I actually appreciate that we're all talking about this now openly, and I also appreciate that you all have your powers to assist. And when you're assisting, you're not just going to be sending cash or whatever. Just talk openly, and if you find a cure or for COVID-19, a vaccine, share the preparation. Don't force it down the throat of other people, of other countries. share the compound and let each individual country decide how they're going to dispense it. We are all one, okay? What happens in this country affects the other. COVID-19 is showing all of us that. So there's no point in hiding behind closed doors and saying that we alone can help you and we need this from you. Meaning one country saying that to the other. We are all one, share equally your findings, help us help those who cannot help themselves. And we're talking about people with dementia here who do not have the ability to speak for themselves. So I need, I'm sorry if it's sounding a bit aggressive, but it just hurts so much to see people being burnt alive when they can be being helped, when they can be being, if there's a law to protect their dignity, their right to equal treatment, their right to medical care. So just to conclude, I am very happy that this anybody, any ideas down anybody's throat. Thank you all for listening.
Thank you so much, Kiki, for a really powerful message. I'm sure there'll be, it'll trigger a lot of questions that, you know, will be picked up in the discussion later. One thing for sure is, as you said, older people are not a homogeneous group. So when we imagine who the older person is, in our minds, you know, we see different people. And when you talk about, you know, older people, and specifically I would assume older women being accused of witchcraft, being stoned to death, being burnt alive, we're not talking about something that's happened in medieval times. We're talking about things that are taking place now. And the very important message that you said, that real results, and we know that from practice, comes from engaging partners and giving people a sense of ownership in the decisions that are being made. So thank you so much for bringing the voices of older persons into this discussion. Now we'll move on to our last but not least speaker, Michael. You know, we've seen verbal hostilities targeting older persons in the pandemic, and as a professor of marketing, I understand you've done your own analysis on this, and we'd be very happy to hear about your work. You have the floor. Thank you. If you can unmute yourself, please, Mike. Thank you.
Yeah, thank you. Thank you very much for the invitation to share my views here today. So I'm Michael Mulvey. I'm a professor of marketing and a researcher at the University of Ottawa's Life Research Institute. And we've been working as a team on a variety of different COVID-19 related projects. And this project I'm going to present is one I took the initiative to investigate. We noticed that there was a rise in the term boomer remover, one of several nicknames given to the COVID-19 virus. This new ageist slur caught the attention of many organizations who promote and advocate for human rights of older persons. Now let me make the connection here. In recent years, I've studied how consumers share their experiences on social media. Social media gives individuals voice to communicate with diverse audiences worldwide. And increasingly, researchers are using social media listening tools to study these conversations, to gain insights into how people think about these issues. The focus is twofold. First, we map the content of the communications to understand what is said. Second, we chart the diffusion of ideas across people and time to understand how it spreads. In recent months, the news media and citizens alike are spreading stories about the COVID-19 pandemic. Each story told is a selective one, intended to convey specific ideas and beliefs. Although individuals tell these stories online, they are far from idiosyncratic. Instead, they exhibit shared dispositions towards particular issues. On February 29th, 2020, the first messages referring to coronavirus as boomer remover were posted on Twitter. Within 2 short weeks, there was an outbreak of boomer remover posts, including commentary, emoji, and images that expressed diverse and polarizing views. Let's have a closer look at the summary results. First, the volume of talk about boomer remover on Twitter exhibits a classic fad curve. It rose exponentially to over 250,000 messages in March, but faded away in the months that followed. The sudden surge in popularity is noteworthy, as more than 238,000 persons authored related posts, and over 1.4 million liked, commented, or shared these messages worldwide, spanning over 100 countries. Collectively, this level of participation created a potential 224 million impressions worldwide. Perhaps most noteworthy or notorious finding was a prevalence of messages worded with positive sentiments about boomer remover. Things become much more interesting when you delve into the actual Twitter posts. Here are some of the accompanying images that illustrate how boomer remover is a polarizing topic. We discovered that boomer remover was considered laugh out loud funny by many individuals, and simultaneously stirred considerable anger and contempt among others. The pandemic is a critical discourse moment that makes position on an issue especially visible. The topic evoked reactions that span the full range of human emotions. The creation and viral spread of the term leveraged emergent genres, including visual memes, hashtags, and emoji, highlighting the need to communicate or understand new forms of communication better. Perhaps most relevant to you, the discourse brought latent intergenerational tensions to the surface, offering us a unique opportunity to observe the ideological sources of conflict that divide generations and create a context for elder abuse. Thank you very much.
Thanks so much, Michael. This is really eye-opening, and in the interest of time, I'll hand over to my colleague Monica to start the discussion based on the panel presentation. Monica, you have the floor. Thank you.
Okay, now I'm unmuted. Thank you, Amal. Thank you for doing a great job in conducting all the work so far, and thank you for all the amazing panelists. I think this was a very rich conversation, and the proof of that is that we have dozens of questions coming in the chat and in the separate mailbox, and it's going to be really, really challenging because time is already very strict. But this means that you were all not only inspiring but thought provocative, and I think part of the goal today was also to challenge the narrative that we have set it up, and you've seen the special rapporteur making it very clear that language matters, and I think that almost everyone picked up that idea because the questions, you have many questions on that issue, and also a wide interest on the other presentations. But if you allow me, I will start with a question to the special rapporteur. And Claudia, you have many questions, and one of them is sent from Help Age, and it says that given all the public statements about elder abuse start with despite the lack of evidence, what do we need to do better or more or less to expose the extent of elder abuse? And we have safeguarding policies, do we? And practices in place, and complaints and feedback mechanisms designed to respond to abuse, but older people rarely use these channels to report abuse. What are the barriers and how can we remove them?
Thank you so much for this very important question. I think one thing which was already stated also in the beginning from our Excellency from Chile is that we are missing data still. So we don't have the real data here because, as many of us already mentioned, also violation of elder abuse is rarely reported. This is not only the fact that they don't know where to go and know where they should claim. It's also because some of them don't really know that this is already a violation of their human rights, because we have to also to have in mind that older persons have their stereotypes and bias in themselves as well. So sometimes they don't really see that it's a violation. And as we already have heard in Michael's presentation, some really laughed loud about these things. But after rethinking it, we would see that it's a verbal abuse. And where do we go then? We know exactly where to go when we see abuse of children or abuse of women. It also took us 10 years and longer. But where to go when we really recognize that there is elder abuse? So we are still having the barriers that people don't know where to go. They don't see it as a real abuse, and they don't really know how to act. And as we already stressed, we don't have a common framework, a legal binding framework for this. So thank you. I think I'll stop here in the case of time.
That was a very clear and powerful recommendation to all of us in the sense of creating more alert mechanisms and sharing the message that verbal abuse, it's only the first step into other abuses, and that we should encourage people to denounce it, but also by creating the platforms. And now I would like to pass the floor to Etienne, because you have also many questions further, a specific request that was already answered by Alana on wanting to get access to the guidelines, but a lot of the questions here in the chat box for you were related into quick impacts. What are the quick wins? What would be your first set of recommendations to implement the guidelines that you've just published?
Well, thanks very much, Monica. I think, yeah, in the interest of time, very, very brief response, but I think first, we have to talk about this issue. We have to put it out there. It has to be part of the mainstream discussion on the COVID response. Second, I think we have to be in contact with older people themselves, make them aware that they should overcome the fears of retaliation, overcome the anxiety and the humiliation of having been victim themselves, and that it's okay to talk about it. Third, we have to keep the channels open so that older people can communicate about what's happening to them. Helplines, caregivers being trained and aware about this issue and aware about how to recognize it. And then we have to make sure the health staff is aware of the issue and prepared to screen and identify those in need. These are some of the things we can do relatively quickly and not too expensively. And finally, I think we have to target also residential care facilities to make sure that they are more prepared and more aware to deal with this issue. Thank you.
Thank you, Etienne. I think that we all have our marching orders, and now we understand how to start to implement the guidelines, and that was very concrete. Thank you so much for that. I think that the people who have joined the webinar, they also want to leave with some takeaways. And Jeline, you have also a couple of questions, and two of them are related with first, how do you explain the lowest rate of financial exploitation in countries like Mexico? You mentioned the example of Mexico. What are the policies? And also, you have another question on what type of signs can we monitor to detect financial abuse in the accounts of older persons?
That's a great question. I'll take the first one, which is about the rates and why we're seeing it differing in different countries and how that relates specifically to COVID-19. And it's two words, it's social isolation. And so we see higher or lower ones specific on social isolation. And as we are more socially isolated, specifically with physical distancing, we're seeing that increase of financial exploitation. The other thing that is a determinant as well is or health determinants in terms of dementia, with higher increases there. There are studies out there that talk about that those who have those kind of health conditions, the amount of money that is stolen is a lot higher. It's almost double when someone has dementia than someone who doesn't when they're a victim of financial exploitation. In terms of the second question, is really interesting. It depends on what type and who the perpetrator is. Of course, one of the ways to look at financial exploitation, what the signs are with regards to accounts, is really kind of the transactional. Those are the anomalies of, this isn't in the same pattern of this older adult, and that's getting harder because people are changing their patterns. And there's, of course, the behavior, and we're not seeing that behavior in the lobbies of financial institutions, but we are still seeing that behavior over the in the call centers. So people are really happy to listen to voices, listen to background. Is there someone speaking on behalf of the older adult that shouldn't be? But I also wanted to address something that's really unique that just came out, which is that when you're looking at family members, to Amal's point, which is, one of the largest ways financial exploitation occurs, especially in COVID-19, where people are, crossing that line and exploiting their family members due to some of the hard times that they're falling into, is that the address where the bank statement changes is a huge red flag. And also with that is really the closure of that bank account. Someone who's had that bank account for 20 years, all of a sudden the money from that account is moved to a different account, and then an original account is closed. And that is a predictor in about 50% of the cases that leads to a substantiated financial exploitation finding.
Thank you. Thank you, Jillian. I think those are good examples that and good advices that we can do the follow-up. And for Kiki, also a lot of reactions to your very powerful and very emotional statement on stigma. And thank you for bringing the voices and bringing the call for dignity and equal treatment of people with dementia. But what we would like to know in the pen and in the chat box. So you said that every country situation is different. Every case is very specific. But what would be your global advice? What would be the general rules that we should all advocate for? What would be the main principles you would like us to leave this webinar and advocate for?
Thank you very much, Mala. The issue, it's not so much that we're also different. It's much more about feeling forced to take somebody's advice. There are ways of being philanthropical. You can give aid in form of maybe a seed for them to grow to eat. You understand what I'm saying. Now, I'm full of emotion. I'm sure it's not something. You are also privileged in that you are so far removed in the ideas in your head about what's going on in Africa. You don't know us. We want you to try and know us, know the situation we've found. Not giving out aid condescendingly, and not I don't want to come across as accusatory, but I'm just trying to explain to you how it might work. If you want to give any assistance, do it by when we don't want cash. It's not about the cash, it's not the monetary bit. I'm talking as a person, as an NGO, that I don't want your cash. I want your expertise, your knowledge. We got quite a wide array of flora and fauna that's very useful. We've existed, Africa has existed with their way of finding herbal solution to things. Just because it comes out of Africa doesn't mean it's bad. We understand you are trying to help, but there are ways of delivering the help, is what I'm trying to explain. I thank you all for being patient with me. But when you've seen people being burnt alive or being stoned to death, just because they're speaking to themselves or they're seeing spirits all over the place, you will get the same way. I don't see it on the streets of London. I don't see it on the streets of New York. Where you have seen these things, you will know that you need to raise awareness. And thank God, the awareness raising is helping. People who used to shut their person with dementia away, who used to lock them away, are now coming up and saying, oh, by the way, my parent has dementia. Fantastic. That would never have happened some 3-4 years ago. But because now they're aware it's an illness, it's not witchcraft, it's not madness, then they're getting better at bringing their person forward and asking for help. That's abuse being curtailed. So we are progressing, but when you are bringing your assistance, your aid, don't make it about the money. Don't just share your ideas, what worked for you, share it with us. Let us look at it, evaluate how it will work for us. Lockdowns, yeah, but lockdowns, where do you expect them to find? We live from hand to mouth, mostly in Africa. If you don't go out to the farm and bring the yam home, nobody eats. So they'd rather go and die of COVID-19 than starve to death, is the feeling. So understanding the situation of the countries would help you help us. Thank you.
Thank you, Kiki. That call to hear people's voices and in this context, to hear the voices of older people and to prioritize their protection and their engagement in defining the policies and the answers. I think it was very clear for all of us. It's ownership that you are talking about. It's not from a top-down solution. It's about a bottom-up solution with the voices of the people who are part of the reality where we're gonna work. And that's really the translation of the UN Charter that starts by "we the people." So I think very clear.
Exactly.
Thank you so much, Kiki, for that. Michael, rushing to you now as the end approaches. We have a very good question to you, and as also to deal with what Kiki was just mentioning. How can we learn from marketing? How can we use social media to counter ageism, but also to promote intergenerational solidarity, Michael?
I think one thing that marketers have, oops, are you hearing me? Okay, thank you. I think the one thing that marketers have been really good at over the years and decades actually is listening to their customers. And so we're very good at sort of paying attention to the nuances and the subtleties of what people are saying and trying to satisfy those needs. And so I think the social media listening, for example, is a good sort of early warning system. And so if we're monitoring what's being said, then we at least get a sense of how people are starting to think about the issue. And if we're measuring it, then maybe we could try to manage it. And so I really think that's what marketers bring to the table, but also they have a long tradition in social marketing as well, and bringing about behavioral change that's positive. And so hopefully more people like I can be invited to the table in the future?
Well, I know that it depends. If it depends on the organizers of this panel, you have a standing invitation for next time. And now I'm going to break a little bit protocol, and I'm going to pass the floor to Federico Villegas. Your Excellency, you have the floor.
Yes, hello.
Yeah.
Good afternoon. My name is Federico Villegas. I'm the new permanent representative of Argentina in Geneva. I presented credentials this morning, and the first meeting that I'm having is this. And so I wanted to congratulate for the initiative. And due to the time restrictions, of course, I will be very brief. I would like to support what the independent expert mentioned about the need to tackle the issue of a new instrument to protect elderly people. During the discussions that we've had in New York all these years, we've talked about many things like financial abuse, care for elderly. But now with the pandemic, we have seen all those discussions in real people, in real situations. So we think, as you know, Argentina has been moving forward to have a new instrument. We think that the pandemic has shown the abuses, but has raised also the awareness in order to tackle a new instrument to protect the elderly, like we did with other vulnerable groups in the past during the development of international law. So I just want to commend for the meeting and commit Argentina to move forward the agenda to get this goal. Thank you very much.
Thank you, Your Excellency. And I have to tell you that we feel quite honored to be the first meeting that you joined after presenting credentials. I think this is a very good signal for us, and we know that Argentina is a champion in this area. So we count on you for continued support. And now you have to believe me that I'm really sorry to have to wrap up this event. And I think it's been great. I think that it was amazing how we challenged some of the myths, how we brought new things to the conversation, how everyone made the point that we need to hear the voices of other persons, how we need to include them, not only in the answers to respond to COVID pandemic, but especially how to build back better. If we really want a more just and inclusive society, the voices of other persons need to be listened to, and they also need to be listened when we monitor the implementation of policies, when we monitor the impact of programs. Of course, I would be dismissive working for an FPA if I didn't mention that we also need to bring a gender perspective to this discussion and talk about overlapping discriminations and about the intersectionality of the responses that we need to devise, but following Kiki's advice of ownership, of making it about the people who we want to serve as the UN, as the international community, as member states. So data, if I have to highlight three things: data, invest in the rights of health, invest in the rights and health of all the persons, bring the gender perspective, and of course, harness this intergenerational solidarity that we've seen coming across as a common ask from all the panelists. From my side, and Amal, and from the organizers of the panel, Sylvia and Susan, and all of us, and all of you involved in the panel, I thank you all for the time. I thank you all for your commitment. And I know that this will be one of the many panels we will have in the near future. Thank you so much to all of you, and have a nice day, a nice evening, a nice afternoon. Hugs from Geneva.